Welcome back, everyone. Chapter 9, slide 21. We are wrapping up our chapter on articulations and movements. So this is the section about movements. Slide 21, let's go over all the different terms that we use to describe the movements of synovial joints. When we say movements, these movement terms that we'll be discussing, once again, it is always at a synovial joint or a diarthrosis, because diarthrotic joints are the movable ones, not synarthroses, not amphiarthroses, only diarthroses, and diarthroses are made with synovial membranes and fluids. All right. This first movement is type of movement is for moving at angles toward or away from the body. Your neck, so it could be at your cervical Z joints. Your appendages could be at your glenohumeral joints or your femoroacetabular joints, and your vertebral column, so your thoracic and lumbar Z joints. To move away from the body, so the movement, say, of your leg out away from your body or of your arm away from your body, that's abduction. ABD, abduction. You've heard of the word abduct. Like if an alien abducts you, they take you away. It's the same word. To abduct means to go away. You're moving away from the body. Adduction, you're bringing together, you're adding, addition. So to move from here towards have the legs come together, have the arm come together, that's adduction. Abduction laterally away from the body, adduction laterally, medially towards the body. We can move our neck, appendages, vertebral column if we're decreasing the angle in this anterior posterior plane. Flexion specifically means decreasing the angle between bones at a joint. I know we use the word flex colloquially in everyday terms to mean just making a muscle toned. That's the word that we'll use for that is muscle contraction. Here, we're talking about flexion where we're decreasing the angle between two bones. So for example, a simple flexion would be at the humeroradial ulnar joint, where you're decreasing the angle between your brachial region and your antebrachial region. That would be flexion. Right now, my hand is extended and I can flex all my fingers here. I'm flexing my interphalangeal, carpal metacarpal, humeroradial ulnar joints. If you flex your glenohumeral joint, imagine that there's this line going above my head. It's coming up this way. This is flexion. So flexion can come in many forms at different joints, but it's always decreasing some angle. The opposite would be extension. If you kick your leg out, kick your knee out, I should say, that's extension. If you move your back this way, you're extending your lumbar, thoracic, and cervical Z joints. Here, this person is flexing, then extending, flexing, then extending. The two flexion and extension that I'll point out more specifically again, glenohumeral joint flexion is when you bring your arm forward. Extension is when you reach your arm back. For your hip, for your femoroacetabular joint, you can't see my hip, but flexion is when you kick your foot out with a straight leg. Extension is when you kick your foot out backwards with a straight leg. Flexion, extension. I'll show you videos where you can see me do this and see my whole body. Circumduction is a more complicated motion that actually involves a bit of everything. But to just encapsulate it all as one movement, circumduction. You're making a circular motion. You can do this with your neck. So your cervical Z joints, you can do this with your arm, your glenohumeral joint, you can do this with your leg, your femoral acetabular joint, your ankle, your talocrural joint. Circumduction. If you have a central axis and you're moving around that central axis with your neck, so with your atlantoaxial joint, that would be left-right rotation. Left rotation, right rotation. You can left and right rotate your vertebral column as well. When you turn your arm, your glenohumeral joint, like your whole arm, it's not along the central axis, it's off on its own axis. So we don't use those terms left and right rotation. We have a special rotation word for them. Medial or internal rotation is if your whole arm turns over, not just your wrist, your whole arm. Same with your whole leg. If your whole leg rotates at the hip, that would be medial or internal rotation. Compare that with lateral rotation, where your whole leg is turning out, where your whole arm is turning out. That's lateral rotation. So this bird, that's left-right rotation, but medial lateral rotation, that's exemplified on the right side, bottom right. Now we're going to get to some very specialized movements. These two terms are used specifically for the antebrachial region, for the radial ulnar joint. Pronation. Pronation is when you turn your palm down, going this way. Pronation is when you turn your palm down to the prone position. Prone is usually when you're face down. This is with your palm down, the anterior side of your hand facing down. Pronation. So you're pronating at the radial ulnar joint. Supination is where you turn your palm up. So it's the opposite. Turn your palm up, facing out. The way I like to think of this, and you'll probably see elsewhere, is that it's like if you're holding a bowl of soup. Please can I have some more? Holding your hand open. That's supination. Pour the soup out, that's pronation. Supination, pronation. At the radial ulnar joint. The talocrural joint can do pronation, supination. It's a very different move. We're not going to go over that, but we're going to go over one that is specific to the ankle, to the talocrural joint. That's eversion and inversion. Eversion is when the bottom of your foot, the sole, the plantar region, moves laterally, moves outward. Eversion, plantar side goes lateral, moves more outward. Inversion is when the plantar side goes medially inward. Eversion, inversion. That's specific to the talocrural joint. Because the plantar side of your foot faces inferiorly, it's very unique compared to your hands. When in anatomical position, the palms of your hands are facing anteriorly, but the soles of your feet, the plantar region, are facing inferiorly. So when you move your foot at the talocrural joint, it's not going to be quite the same as flexion and extension. Flexion, extension, flexion, extension. We use different words. These words are used specifically also for the talocrural joint. Dorsiflexion is when you bring your ankle up. When you elevate the distal portion of your feet and toes. Dorsiflexion. Plantar flexion is when you put your toes down like you're trying to touch the ground, like you're trying to plant your feet. Dorsiflexion, plantar flexion. So they're both special types of flexion. There's no extension here. It's just dorsiflexion, plantar flexion. Vertebral column can bend in a lot of funny ways. To bend laterally side to side, it's just lateral flexion. So you have left lateral flexion and right lateral flexion. Most of this movement can happen in your cervical Z joints or your lumbar Z joints. You have a little bit of thoracic movement. I mean, there is thoracic movement, but it's not as drastic as the cervical and the lumbar. Several joints, including your temporomandibular joint, cervical Z joints, acromioclavicular joints, femoroacetabular joints. You can move them in vertical, and horizontal directions. If you move your neck like a chicken, protraction is when you bring your neck forward. Retraction is when you bring your neck backwards, posteriorly. You can do this with your temporomandibular joint. I wouldn't do that personally. I don't like doing it because it doesn't feel good, but it's possible. Protraction and retraction. You can also do this with your shoulder, with your acromioclavicular joint. You can protract and retract your acromioclavicular joints. At these similar joints, you can also elevate and depress. When you shrug your shoulders up, when you shrug your acromioclavicular joints, that's elevation. When you put them down, you can even bring them down, that's depression. Elevation, depression. When we're talking about our temporomandibular joint, to open your mouth is depression. To close your mouth is elevation. Depression, can't do it when I'm talking, but depression, elevation, depression, elevation. Our thumb is special because it's opposable. It can come to our palmar region or to our fingers, to our digits, our phalangeal regions. Whenever our thumb comes to the palm or to one of the fingers, we call that opposition. You can describe it as opposition of the pollex to the fifth phalanx, or opposition of the pollex to the palmar region, depending on where you put your thumb. To put it back is reposition, opposition, reposition, opposition, reposition. So that's a very special movement just for the thumb at the first metacarpophalangeal joint. Metacarpophalangeal joint. Those are all the movements that I'd like you to know. And all these movements can be applied to all the joints that we've discussed, and look for the chapter study guide for the full list of terms, full list of joints that you should know. It's not an exhaustive list, but it's a lot of joints that you should know, major ones in our bodies. Overall, I'd like you to remember that, well, one thing I'd like you to take away from this is that when you want a joint to be stable, when you want to move a joint, you need muscles. Muscles move joints. And so if you want to strengthen a joint, you can't do, realistically, most people can't do much to strengthen the cartilage or strengthen the ligaments. You can, but the number one thing to do is to strengthen the muscles that surround the joint. So when someone says you should strengthen your joints, what they really mean is you should strengthen the muscles that surround the joint. What we often don't focus on are stabilizing muscles, and that's something that you should ask your physical therapist about, especially if you're injured, to help you rehab a specific joint. Muscle tone is the most important factor in joint stability. You're keeping tension more on the muscle than instead of on the tendons and ligaments and the articular cartilage. Also, in general, if you see more ligaments surrounding a joint, that generally means more strength, more stability at that joint, because there's things holding it back. When we went over the knee is a very, it's a joint that needs a lot of stability because there's a lot of stress on it. Just did slide 31, slide 32. A little bit about some joint conditions. There's a lot of different joint conditions out there. We're only going over 3. Collectively, the name of these joint conditions is known as arthritis. Arthro, remember, means joint. itis means inflammation or damage to. So damage or inflammation of joints, arthritis. There's over 100 different kinds of arthritis. Let's go over 3 common ones. Perhaps the one that you think of most, and that most of us will experience, especially as we get older, is osteoarthritis. Osteoarthritis is your normal wear and tear arthritis. Cartilage erodes over time, and it doesn't heal very well, remember, because it's avascular. So as we get older, or if we play lots of high impact sports or other activities, that can start to wear down on the cartilage, say protecting our knee or protecting our other joints, depending on what activity we're doing. That's osteoarthritis. If you watch some TV commercials, you might see ads for drugs that treat rheumatoid arthritis. It's pronounced rheumatoid. Rheumatoid arthritis is an autoimmune condition. That means your own cells are attacking your joints. Your own immune cells, your own white blood cells are attacking your joints. And that can cause inflammation. Not fun. It tends to be more prevalent in females than in males, likely due to hormone levels. But yeah, it is somewhat treatable with medications, but there's no cure for it. It's hard to combat your own immune system when it's doing the wrong thing. The third type of arthritis that I'd like you to know about is gouty arthritis. Often it's just called gout. Gout. Gout, you may have heard of this condition in people who live very decadent lives, or I should say, who eat very decadently and without eating a balanced diet. If you eat primarily proteins and lipids, so really high fat diets, like let's say you eat meat all day and that's all you eat, there's a higher risk that you'll get a buildup of this waste in your body called uric acid. Normally, uric acid does not form in our bodies. Normally, it's this soluble form called urea. And urea dissolves dissolves in water and gets into our urine, and we eliminate it. But if urea builds up so much in your body because you have an imbalanced diet, it can crystallize and form something called uric acid. And these crystals tend to accumulate in your joints, especially with gravity down to your feet, down to your toes. And those crystals get into your synovial fluids. That prevents lubrication. In fact, it will cause even more damage. You can't move your joints, it swells up, lots of pain, no fun. This tends to be more prevalent in males, yeah, caused by hyperuricemia. That means an elevated level of uric acid in your blood. When you see the word emia, I-M-I-A or E-M-I-A, or the root word emia, like anemia, it's referring to blood. All right, 3 examples of arthritis and what causes each one of them. So we've gone through these 4 videos, different types of joints. We have diarthroses, amphiarthroses, which are slightly movable, and synarthroses. Oops. Supposed to move, but we have movable joints in our body. We have joints that are load-bearing and move slightly, and then we have joints that don't move much at all because they're more for protection. And they're made of different things for different purposes. So I hope that is helpful to you. If there's anything that you'd like me to clarify, once again, please let me know. Leave questions in the comments or in the discussion on Canvas. Thank you, everyone. That wraps up chapter 9. I'll see you in chapter 10.